Hi there, this is Dr. Evan Osar with the Institute for Integrative Health and Fitness Education. Welcome to this edition of Integrative Movement Insider. Hope you're having a great day. Hope your week started off well. Just want to talk about the hamstrings because this is in relationship to a brand new series of Two Anatomy Geeks that Jill Leary and I have started. This 4-part module is all about learning the functional anatomy around the knee, the quadriceps, the hamstrings, as well as the popliteus, and how these muscles all work to align and control the knees. Because so many of our clients, so much of the population has knee problems. It's the most common orthopedic surgery, it's the most common joint replacement. There's 7.2 million Americans walking around with hip and or knee replacements. So we have lots of individuals that need this information and need your expertise. So thank you so much for joining our community here at the Integrative Movement Institute, as well as joining our community of Two Anatomy Geeks, which I'll tell you about at the end here. Now, one of the things that directly leads to and contributes to knee problems is the lack of anterior pelvic rotation, the ability to move the pelvis anteriorly over top the hip joints or the femoral head. Now, how does that relate to knee issues? Because when people go to squat, then the individuals go to squat, instead of being able to get back into a chair like this and being able to use a hip hinge or that anterior rotation of the pelvis to make it happen, what happens is then they just start translating too far forward through their knees, and then they just sort of plop back down into their chair. And when they go to exercise or get down to grab something from the floor, they basically are just knee flexing and or spinal flexing. They're not actually hinging to get that pelvis to rotate anteriorly. And that oftentimes has to do directly with short hamstrings and external hip rotators. So what that does is, just do this with me, just go into posterior pelvic tilt, which many of us are as fitness professionals because we've been taught that anterior pelvic tilt isn't a good position, so most of us have biased ourselves into posterior pelvic tilt. Well, now if we try to bend forward, we can't do it very well. And now if you keep yourself in posterior pelvic tilt, go to squat now. What happens now is the knees will go forward, and even if you try to push those hips back, your spine stays flexed, your pelvis stays in posterior pelvic rotation, and you never really get that loading from the pelvis that you need to actually take the pressure off the knees and load up that posterior chain, glutes, external hip rotators, and hamstrings. So, oftentimes we need to release or lengthen, lengthen those shortened hamstrings. One of the best ways to do that is not how most of our clients do it. Here's how most of our clients do it. They do one of these things, they just bend forward, and all they're really doing in this position is they never really get hamstring length. I've never seen anybody actually improve their hamstring length by doing this, because what they're really doing is overstretching their low back. Let me show you. So if you think of the hamstrings and the low back as elastic tubing, just imagine like one is very elastic, and one is very stiff and rigid, and the other of these two areas is more rigid. So which of these two areas looks more rigid as I go to bend forward? You see my back bends very easily, so that's like a very easy elastic resistance here. This is flexing very easily. Unfortunately, the hamstrings, which are stiffer, so now think of a thicker, stiffer resistance band, this one is not releasing. So I keep stretching my low back in relationship to my hamstrings, and the hamstrings never get longer. In fact, that almost reflexively inhibits them. The more you stretch the low back, the more you you lose control. You almost destabilize the low back to a certain extent, and now the hamstrings keep getting tighter because now your body has to do, your nervous system has to do something to help stabilize what you just overstretched. So that's why how you help your clients lengthen their short hamstrings is just as important as actually creating the length there. So one of the easy things you can do, obviously you'll do your myofascial release, do all the things that you know how to do so well. But one of the easiest ways to do that is really to teach someone how to do a hip hinge and use a support. So I'm going to use a chair here. You can use the wall as well, or you can use a bench in the gym, whatever your client has available. So many people are working at home now, so this is very easy for them to do. They can use their desk as well. So have your client just align their head and neck and rib cage over top of the pelvis to the best of their ability. Now the first motion is create the hinge. It's not pushing the hips back like this. It's create this hinge, allow your clients to hinge so they actually load up that posterior hip. Then place the hands on the chair like so. So now keep that alignment, head and neck, rib cage over top of your pelvis, step back. So now your head and neck and rib cage are aligned over top or in line with the pelvis. Now, again, it's important that we get that rotation of the pelvis so we stay in that relative anterior rotation of the pelvis, but it's really rotation of the entire cylinder, not just of the pelvis. Now from here, usually start forward, so breathe in and then lean back, shift back, not lean back, but shift back, translate your weight back so that the pelvis stays relatively over top of the feet, and now send the tailbone towards the ceiling. So it's not this, it's not arching the back, it's sending the tailbone towards the ceiling to get length here in the hamstrings, to maintain the spine in the same position throughout the pattern. Maintain this position, and now send the breath down that direction towards the pelvis. Focus on spreading or widening the sit bones, those ischial tuberosities, because again, a lot of our clients are tucked and gripped underneath. So this is the exact opposite position to lengthen that posterior hip complex, to lengthen the hamstrings, and then use the breath to maintain and reinforce this alignment. So breathing in, breathing out, sending the breath down that direction. Again, breathing in, breathing out. Again, with my feet, foot tripod, big toe, small toe, heel, trying to spread the feet, or I should say spread my feet on the floor, but spread the floor in between my 2 feet. Maintaining alignment, send the breath down this direction, and we'll do that for 3 to 5 breaths for around 3 rounds. Because if you check your range of motion, I should have checked this before we started, if you check your range of motion before and after you do that, you'll notice that you get a lot more length in the hamstrings. Because ultimately, when you're starting to teach your client how to deadlift, the deadlift is really just that same position, that hip hinge position. And too many of our clients, their hips are way back here, and they're taking the weight off their feet, and they're just really rounding their back by shoving their hips back. You want to make sure that they align that TPC, that thoracic-pelvic cylinder, then hinge. This is what this whole pattern was setting you up for, is the ability to hinge and create that rotation of the pelvis over top of the feet to take that stress off the knees, put it back here where it belongs, and it also takes the stress off the low back as well. So again, you load up the posterior chain, and now you can sort of do your deadlift pattern with load, saving the knees, saving the low back, and really improving the strategy of how your clients are using their glutes. Because it's not about weak glutes, it's about inability to actually access the glutes to create that eccentric lengthening that you need to use the glutes appropriately. I hope that made sense. Give it a try. Check your range of motion first. So do a quick, easy forward bend test, knees straight, slide down. And again, that actually worked incredibly well. I couldn't get my hands on the floor before I shut the video. Here we go. Again, knees straight. So it's a powerful exercise. Just maintain alignment. Focus on spreading through the sit bones. So you're visualizing the sit bones going wide in this direction and sending the breath down low to create that length and to respect the alignment of the low back. And then the nervous system is happier, giving you more range through the hamstrings because it knows the low back is controlled through that position. Great way to teach the hip hinge, great way to lengthen the hamstrings, great way to ultimately set up all the patterns that you need, squatting, deadlifting, even lunges and patterns like that, and reducing stress on the knees, which is exactly what we're talking about in Two Anatomy Geeks this time. And actually, we just did module number 1 yesterday. We started yesterday with the quadriceps. Next week, next Monday, is episode number 2 of 4, where we're discussing the hamstrings. We'll go into the anatomy of the hamstrings. We'll teach you more corrective exercise strategies and assessments, like how do you assess hamstring length, true hamstring length, as well as how to use corrective exercises to help improve function of the hamstrings so that you become that go-to specialist for your current clients and help more clients that have chronic knee issues like osteoarthritic knees or coming off joint replacements, and or those clients that just struggle with basic patterning. This strategy that I just shared with you is just a little bit of what we're covering in Two Anatomy Geeks. And again, like I said, Jill, my fellow anatomy geek, and I, we really worked hard to bring you a series that helps to up-level your education, so that way you actually understand why you do what you're doing, why some of your clients have chronic issues, and then ultimately give you a strategy for helping your clients. Because it's great to know, to learn knowledge. If you're part of our community, you love learning knowledge just like we do. However, it's also important to be able to apply it, and we want to make sure that you apply your information. Two Anatomy Geeks is a super cool way to learn anatomy and apply your information directly to your clients. People have been loving this series, so we'd love for you to join us. I'll put the link, or I should say the link is next to this video, so check it out. Hope to see you next week at Two Anatomy Geeks. All sessions are recorded, so if you can't be on live, feel free to access the recordings. You have those for the entirety, so once you enroll, you have access to all the recordings. So we would love to see you on Two Anatomy Geeks, help you learn strategies to help your clients with chronic knee issues. And if you have any questions, feel free to leave them next to this video. And yes, I did order a microphone, so hopefully next time I see you guys here on Facebook Live, I'll have my new microphone. All right, make it a great day. If there's anything we can do to help support you through these trying times, a lot of us are struggling. A lot of people are being still in quarantine. Some of these cities are shutting back down. So if there's anything we can do to help support you, uplift you, and empower you during this time, please reach out and let us know. And thank you for all you do for your community, for your clients, and allowing us to be part of your journey as well. This is Dr. Osar with the Integrative Movement Institute. Make it a great day. We'll talk to you soon. Bye-bye.